Are there different types of lung cancer? Lung cancer is cancer that starts in the lungs. The most common type is non-small cell lung cancer, NSCLC. NSCLC makes up about 80 to 85% of all cases. 30% of these cases start in the cells that form the lining of the body's cavities and surfaces. This type usually forms in the outer part of the lungs, adenocarcinomas. Another 30% of cases begin in cells that line the passages of the respiratory tract, squamous cell carcinoma. Please don't forget to like, comment, share and subscribe. Thank you. Small cell lung cancer, SCLC, represents about 15 to 20% of lung cancers. SCLC grows and spreads faster than NSCLC. This also makes it more likely to respond to chemotherapy. However, it's also less likely to be cured with treatment. In some cases, lung cancer tumors contain both NSCLC and SCLC cells. Mesothelioma is another type of lung cancer. It's usually associated with asbestos exposure. Carcinoid tumors start in hormone-producing, neuroendocrine cells. Tumors in the lungs can grow quite large before you notice symptoms. Early symptoms mimic a cold or other common conditions, so most people don't seek medical attention right away. That's one reason why lung cancer isn't usually diagnosed in an early stage. What are the symptoms of lung cancer? Symptoms of non-small cell lung cancer and small cell lung cancer are basically the same. Early symptoms may include lingering or worsening cough, coughing up phlegm or blood, chest pain that worsens when you breathe deeply, laugh, or cough, hoarseness, shortness of breath, wheezing, weakness and fatigue, loss of appetite and weight loss. You might also have recurrent respiratory infections such as pneumonia or bronchitis. As cancer spreads, additional symptoms depend on where new tumors form. For example, if in the lymph nodes, lumps, particularly in the neck or collarbone bones, bone pain, particularly in the back, ribs, or hips, brain or spine, headache, dizziness, balance issues, or numbness in arms or legs, liver, yellowing of skin and eyes, jaundice. Tumors at the top of the lungs can affect facial nerves, leading to drooping of one eyelid, small pupil, or lack of perspiration on one side of the face. Together, these symptoms are called Horner syndrome. It can also cause shoulder pain. What are the symptoms of lung cancer? Symptoms of non-small cell lung cancer and small cell lung cancer are basically the same. Early symptoms may include lingering or worsening cough, coughing up phlegm or blood, chest pain that worsens when you breathe deeply, laugh, or cough, hoarseness, shortness of breath, wheezing, weakness and fatigue, loss of appetite and weight loss. What causes lung cancer? Anyone can get lung cancer, but 90% of lung cancer cases are the result of smoking. From the moment you inhale smoke into your lungs, it starts damaging your lung tissue. The lungs can repair the damage, but continued exposure to smoke makes it increasingly difficult for the lungs to keep up the repair. Treatment for lung cancer: it's usually a good idea to seek a second opinion before beginning treatment. Your doctor may be able to help make that happen. If you're diagnosed with lung cancer, your care will likely be managed by a team of doctors who may include a surgeon who specializes in the chest and lungs, thoracic surgeon, a lung specialist, pulmonologist, a medical oncologist, a radiation oncologist. Discuss all your treatment options before making a decision. Your doctors will coordinate care and keep each other informed. Treatment for non-small cell lung cancer, NSCLC, varies from person to person. Much depends on specific details of your health. Stage 1 NSCLC, surgery to remove a portion of the lung may be all you need. Chemotherapy may also be recommended, especially if you're at high risk of recurrence. Stage 2 NSCLC, you may need surgery to remove part or all of your lung. Chemotherapy is usually recommended. Stage 3 NSCLC, you may require a combination of chemotherapy, surgery, and radiation treatment. Stage 4 NSCLC is particularly hard to cure. Options include surgery, radiation, chemotherapy, targeted therapy, and immunotherapy.